Welcome to the Thrive Tribe podcast, a place to discover a community of practitioners who can support women to achieve good health beyond just the traditional methods. It's also a place to empower women with the knowledge they need to better prepare their body, mind, and spirit at each stage of their life, from periods through menopause. I'm Chandani Shamwatwani, your host and functional nutritional therapist. I look at each individual's unique needs to manage their long term health challenges and prevent future issues long before symptoms appear, our body whispers. I work together with you to identify those signals and address critical areas to set you on a path of vibrant health and vitality. Our sponsor, Blissamy, is your personal health companion, a smart platform that blends your biometrics, life stage, and wellness goals to create a tailored health journey just for you. Whether you're navigating women's health, chronic care, or mental well being, Blissamy guides you to the right holistic providers, products, and programs all in one place. Hi everyone, I'm Chandani Shamwatwani. Today we have with us Cecilia Tay, and she is a traditional Chinese medicine practitioner here in Hong Kong. She started the Vitality Clinic how many years ago?
March 2001.
Oh wow,
So,
24.
Yes.
We've just hit 24
Yes,
years.
exactly. We have. Yeah.
That's incredible. Okay, so many of our listeners are probably very new to traditional Chinese medicine. So can you just share a little bit about what is the approach to health that traditional Chinese medicine takes and how does it differ?
So Chinese medicine looks at symptoms always as just a little reflection of something underneath. It can be something simple, by the way, like a cold. It is just because of a temporary, call it an exogenous invasion factor of like wind or cold or heat or damp. They've got these natural phenomena rather than bacteria and virus and so on, because obviously at that time they could not, the microscope wasn't even invented, so they could not see these critters. So symptoms are just like a gauger of what is happening underneath. And so the approach is looking at the body more holistically. Even a healthy person I see, which I love, I see people who come maybe once a season, some people every 2 months or whatever, to know where they're at. And they just ask me, okay, should I help a little bit on this side and this side? Because they understand that health is like a garden, making sure that your plants in the right spot. Have I allowed for enough sunlight for this particular type of species to flourish? Is it a bit too wet, maybe? So you groom, you prune, you groom, add fertilizer if needed, you loosen the soil. So that is what Chinese medicine practitioners do. They look at, is this garden, the conditions of this garden, is it enough so that things can thrive and flourish in this garden? So it's not only like I'm ill. Chinese medicine, it's not a black and white. There is a dysfunction that starts happening.
Yeah.
And then at a certain time, people themselves will feel, now I'm sick. But in the meantime, the dysfunction was already way earlier. You will often notice, especially with chronic things, like I always had a little bit of a tendency to have headaches, but they would only come when I'm really stressed, or they would only come when I have my men's period, and then I would not have them at all. But over the years, things can become worse and worse and worse. Then at what time does a patient really feel, okay, this is abnormal, now I'm sick? In Chinese medicine, we don't say it's something new suddenly happened, unless there's a real trigger. It's also interesting for me to find out if something was indeed always the case, but it was very manageable. Why is it suddenly much worse? That is something to then puzzle out and keep asking. As often you will find there is a time in a person's life where hormones, for example, took such a big change, or something in a job change, or a spouse change, or a country change, or something like that. So that is you actually look at lifestyle things much more than a Western medicine practitioner does. Put a problem into context. So a Western medical doctor, same thing, I've got a headache. All right, okay, take then this Panadol. Okay, if that doesn't work, they then change different drugs, even to migraine medicine, or you use sometimes even injectables. None of this puzzling is happening, but the same symptom coming to a Chinese medicine practitioner, suddenly I ask all these things. And I still see some people, like women that come, for example, indeed for a headache, and I ask them about the menstruation. They say, yeah, I'm coming for my headache. I know, but can you tell me about your menstruation? And then so I have to also educate the person to let them know that the reason I'm asking about something that seemingly doesn't relate, I'm trying to find what is the situation of this garden.
What is the state of it? What's not thriving? What's dying? What's too wet? What's too hot, too cold? This is not blooming, because you're thinking of what your whole body being a series of different flowers and garden.
Exactly. The woman may come in this metaphor saying, my roses are not thriving. Let's concentrate on the roses, and you can just put more fertilizer in there. What I'll do is, could it be that the neighbors put a fence up? Or what else is happening in the neighbor's garden that now puts so much more shade over this patch of roses, for example?
Oh, is in the neighbor of the headache is maybe your entire hormone system.
Correct.
Right? Yeah.
Correct. Absolutely.
Right.
So I have to look at what else is playing, and people who say, "But can we just go back to my headaches?" That is when I say no.
Yeah, and
TCM
I think the biggest thing is that this is immediately what you go to. It's not something that after you repeatedly come to a TCM practitioner, they're like, okay, maybe we should think about the root cause. Because I think with Western medicine, they'll first give you the Panadol, they'll first give you overdose, and then after repeated complaints,
then they will do an MRI,
Yes.
which even me, I do refer people back again to Western medical doctors. So then the circle goes round. On one hand, I say what is different. On the other hand, I don't want to discredit especially the diagnostic tools from a Western medicine point of view, things related to imaging. They're like out of this world. It's amazing.
So actually, that's what you're saying, is that they can be complementary to each other. It's not either or. And I think that's really valuable to hear, because a lot of times people will focus only one type of treatment, but actually your body is much more complicated than that. So it's important to look at it holistically as well. Yeah,
absolutely. And for certain things, I'm absolutely not a fan of antibiotics, but a few times, probably can count them on my hand, I've had women with mastitis when it's already to the level, and I always give them 1 day very strong herbs with acupuncture. If it's not getting better, then sometimes antibiotics really are needed.
Yeah.
And then after that 1 day, I'm the one who will say, please go and get yourself some antibiotics. It's really important for a practitioner to not get stuck in any modality. And also that's one of the reasons why Vitality Center is formed.
I wanted to go back and talk to you a little bit about all these exogenous factors: wind, cold, heat.
Yeah.
I think that this is really important, because when I first came to a traditional Chinese medicine doctor, when I first moved here, I had a lot of skin problems. I walked into Hong Kong and my skin just went berserk. I already had them foundationally, but it got really bad. And I remember I went to a acupuncture and traditional Chinese medicine doctor in TST, and she said, you have evil dampness affecting you. I had no idea what that meant. I was like, what does evil dampness affecting mean? But whatever she did, whatever she gave me, I started to feel better. What I realized is, oh, evil dampness must mean I had some sort of humidity problem affecting my body. I really started to believe it because I was feeling better on the medicines that she was giving me. And then later I did discover, many years later, I have some mold toxicity that I am dealing with. I did the functional medicine mycotoxin test, and I discovered my ochratoxin is very high. So again, I found this connection between the TCM evil dampness and what's been going on in my body for so many years. What I'm seeing here is that traditional Chinese medicine is really one of the first holistic medicines, like functional medicines, that we're seeing in the world, right? In the way that they see this through. You said cold, heat, wind, dampness. These are all climatic, environmental pathogens. And then we have emotional factors as well, emotional pathogens almost, or like states. And then we have our intrinsic or inherited traits. And Chinese medicine takes into consideration all of this and then looks at and diagnoses and treats what's in balance, what's out of balance. Is that right? Yeah. So it's not esoteric or magical like I thought when someone said you have evil dampness affecting you, but it's actually based in looking at our environment, our internal state, and our inherited state, and actually putting together what is causing these problems.
Yes. I think everywhere in the world, medicine, I think the instinctive knowing, and I look at my dogs, and they sometimes just go for a certain patch of grass, and they want to nibble on that grass. I still haven't figured out why, and why not this grass but that grass. It's because another dog had been there. I think there's an instinctive knowledge in mankind, or in animals as well, that comes with healing. So Chinese medicine is unique in such a way that they came with a structure, and they had Taoist system underlying this. So it became a really beautiful philosophy, and it started to be written down. So then suddenly it became like a proper medicine, whereas all the other, which in other places of the earth must have happened simultaneously, it may have just forgotten.
Right.
So I just wanted to put that out there. I don't want to just claim supremacy on the Chinese
absolutely.
medicine.
I think it's just one of the ancient modalities of
yes. And then again observing, and I think they then put things into categories. Like when you talk about mold and we talk about dampness, it's normal when you have in nature a more damp environment will have visible signs of mold. So it's just the fact that it has become invisible inside the body. We can still put it as damp. We can, because a lot of things behave that way. The same way that when we talk about heat and we look at things that, of course, we can talk about the yin and the yang. We look at nature. What is heat? How does heat behave in nature? How does cold behave in nature? And then we look at the body, and does this body behave more in the category of cold, or does this body behave more in the category of heat? And then you put it in a category. So it's on one hand very complex, on the other hand can be
very simple.
Very simple.
And actually that makes sense, because I had to take a mycotoxin test to get that diagnosed. But someone, I think, just felt my pulse, looked at my tongue and said, you have dampness, right? It can be very simple. There's obvious signs, and Chinese medicine has tools and methods to actually read those obvious signs, right? Yeah, that's great. So I think I want to go back to another question. I see two types of TCM practitioners, more like bone setting, tuina, cupping kind of practitioners, and then I see more of the herbal and acupuncture. Do you just go to anyone, or does everyone practice everything, or how would I know who to go to for different issues?
They should have been all part of your education at least, and then there's different affinities that you then specialize in more.
Okay.
But I can imagine that in the old age, proper Chinese medicine practitioner should have had all the skills, and would have had all the skills. You need to do martial arts to understand martial arts if you want to be a good bone setter. And I absolutely agree with that. The same way that you should be able to do a certain level or have a certain understanding of your own qi, qi or qigong or meditation, to be an effective acupuncturist, because you do need to also try to imagine what you feel under the needle more than just anatomically, but also from literally it's called de qi. It means grab or get the qi from the patient. And de qi also means what the patient experiences by having that needle and what the practitioner experiences by doing that needle. So there's a qi component to that in order to be a good practitioner. Also, and this is more like a modern thing, how they classify things in your study. And then further on in Hong Kong, I am registered under the Chinese medicine ordinance for herbal Chinese medicine with acupuncture. But there's also those who are registered under just tuina and massage as their main thing.
So it's two.
But that's
modern.
It's a modern thing. It's not an.
It's okay. Understand. That makes sense. But then now also different practitioners have different affinities, which is right. Okay, that makes a lot of sense. So I know you did your studying in Beijing. How many years did that take?
For me, it took 7 years because I did not speak Chinese when I arrived in China.
You learned Chinese first?
I went to a university. At that time it was called Beijing Language Institute, but now they've got a longer name. And you can then sign up for a course that prepares you and gives you vocab. So as you're learning Chinese, you are introduced to vocabulary that is going to be of use to you in your further studies. So you still obviously have to learn the basic of Chinese language. But I remember, like, in the second lesson of Chinese, you learn mama, papa, and then the third word was X-guang, which means X-ray. And on the other hand, everything related to politics and economics and so on, they would take out of the curriculum. So it was a more dedicated way of learning Chinese. And even my first year when I studied Chinese medicine, I was the only Westerner in my class of 120 odd students. It took me 7 years because of the 2 years learning, and then an additional 5 years full time.
That is such an inspirational story. That's some kind of dedication. I think the main thing that I really have admired about you, Cecilia, is your ability to integrate functional medicine principles and ideas into it, suggest supplements, suggest dietary advice, and create that translation or that bridge between TCM and functional medicine. I think it's very powerful. So what led you to start combining those two?
So first of all, I was educated with a lot of normal Western medicine basics, really. In fact, our first year of anatomy, physiology, biochemistry is actually it's the same as the cohort in Beta that was studying Western medicine. So that's the Western medicine context where I was lucky enough, and that's why I also chose to study at the university where they would have both, and that you would actually come out with a proper university degree, Bachelor of Medicine, not just Chinese medicine. But insofar that at the internship time, you're practicing side by side with other interns who come from the Western medicine stream. And we actually don't even know anymore who came from which stream. We were both allowed to prescribe Western medicine drugs,
Okay.
do IVs and everything else.
Oh, wow. Okay. And this was in Beijing?
This was in Beijing at that time. And
Mhm.
obviously these rights don't apply here to Hong Kong. A very clear differentiation between the Western medicine, both fall under the Department of Health, but you've got the Western Medicine Council and you've got the Chinese Medicine Council.
Yes.
To answer that part, Western medicine was for me always already a part of my education, to the basics. But even pharmacology, Western medicine pharmacology at that time was part of my study.
Oh, wow. Okay. I had no idea.
So that's where I come from. But then the functional medicine part, as in supplements and so on, that was absolutely not part of my study.
Okay. And that's where you kept learning.
And I just had to keep learning. And then when you start learning, then you get into this rabbit hole. It's a whole new world that opened up. And there's a lot of overlap with what naturopaths do and GPs who've studied functional medicine. So my knowledge compared to proper functional medicine practitioners and proper naturopath is still very shallow, but enough in conjunction with my Chinese medicine to add value. And it is really important because unfortunately Chinese medicine came from a time when, of course, we did not need to worry about the microbiome aspects having been killed by a huge amount of antibiotics. We did not need to worry about vegetables not holding anymore, not containing the right amount of nutrition.
Yeah.
And same with fruits and so on. So at the moment, if you try to eat quite healthily, even if you try to eat organic, let's say, and it's a whole other topic, like what is organic.
Yeah.
A lot of times these plants just don't contain anymore the same amount of nutrients that they used to do even 100 years ago. I don't even need to go back 3,000 years ago, but still.
Actually, I read recently something that said in the 1980s, I think, a piece of broccoli had 50 times more calcium and magnesium than it does now.
I wouldn't be surprised. I didn't know that.
But what you're saying is absolutely correct. And so that even if you are eating in like a healthy way, you still have some deficiencies often, right?
Yes.
Yeah.
And that's why I've started to ask people, and especially when you're looking at building up, and we will get there later on, we're trying to build up a lot of women for fertility reasons and so on. You have no choice but to also look at the nutrition.
Yeah, absolutely. And writing off of what you said is even people who ask me, and even my family members are like, I'm eating so healthy, why do I need any supplementation? I said, because what you're eating doesn't have enough of what you actually need. And they're like, oh, our grandparents or our ancestors have been eating the same food for centuries. And I was like, but the food is different. The food quality, and that's what you've really highlighted.
And the soil.
And the soil,
absolutely. It's a huge
and also
difference.
how we prepare our foods is so different, right? So yeah, that's really true. That's very powerful. And I think that combination has helped me a lot from you. So you've inspired me to not only focus more on my nutritional side of stuff, but also now I'm also starting to learn based off of your recommendations, some very basic acupuncture. So
I'm delighted.
Yeah, a lot of our listeners are biological women. They're dealing with all the stages of hormonal changes that women go through, right? Whether you're just menstruating, preconception, actually trying to get pregnant, fertility issues, or if you're pregnant or you're dealing with postpartum like I am, and perimenopause and menopause. What's TCM's approach or philosophy on women's health?
So women are actually a real entry of saying women's health per se, and what is the woman's physiology versus a male's physiology. You always have to start with what is the healthy situation, and then what is the non-healthy, right?
Yeah.
They talk about the cycle of sevens
in TCM.
In TCM. And for women, it's a cycle of sevens, and for men, it's a cycle of 8. So the different parts of maturation from a girl to menstruating, to fertility age, all the way to perimenopause and beyond, is explained in cycle of 7. So from the first 6 years of life, and from 7 until 13, and 14 till 20, 20. So they actually are they identify when things are coming into fruition and what the next stage is. And when things are according to stage, leave it alone. When things are not according to stage, that is when we talked about premature ovarian failure. This is one of the times when it's okay, this woman is in this phase but has prematurely an ovarian failure. Okay, how can we help? So women's health is described in that way. Women's health is described always in respect to blood. So again, going to this example of a headache or even a shoulder pain for that matter, or something mechanical. Almost every woman, I will quickly ask about their menstrual cycle, irrespective of what they come for.
Oh, really? Okay.
I've never seen them.
Yeah.
Because menstrual cycles is for me an indicator of how well does the chi flow, how well does the blood flow. And that having a good blood flow and good chi flow at least tells me a little bit, oh, how am I going about this sinus problem?
Right.
Is it really just an external temporary thing, or is underneath the chi already blocked, and this is just going to repeat itself even if we temporarily help this patient now? So women's issues, women's health, we always look at blood.
Right. Okay.
We look at Jing. Jing also we look for men as well, but Jing is the essence that is the blueprint, is what we are gifted from our ancestors, but it's also what we will hand over to our next generation. And it's really important. So the Jing is the one that then does all these 7 cycle, how do you call it? So this every 7 years goes into a next phase. So we're trying to make sure to find out how is the Jing of this person. The Jing is also the one that helps with fertility when we need to get the yin and the yang together.
Yeah.
Even if you have the perfect timing, they will not dance, they will not tango or integrate without that sparkle of magic dust
from the Jing.
Yeah. So women's issues, women's health, we talk about blood, we talk about Jing, and then the Jing is held in which, if you talk about the 5 elements, the organ system, which organ holds the Jing is the kidney.
Okay.
So that's why often when we're talking about fertility related stuff, and actually even talking about perimenopausal things, or a delayed puberty, or all of those things that I mentioned that are in supposed stages, we have to go from an organ system and look at the kidney, because the kidney holds that essence.
So amazing, because in Western medicine, it's a completely different concept. The kidney is a filtering device for your bladder, right? It doesn't even have a place in this conversation, really. You're really only talking about your adrenals and your uterus when it comes to women and women's health, and your thyroid and your hypothalamus. Those are the main things you're looking at from a Western medicine perspective. But in Chinese medicine, it is the Jing, which is held in the kidney. And the kidney is more than just an organ, right? It's
so it's not just the anatomical organ. By the way, those real kidneys, the Western medical kidneys, also fall under the Chinese medicine kidney. It's not a completely different entity altogether. So the anatomical kidneys, with its production of urine through the whole filtration system, and is also part of Chinese medicine kidney. And of course the adrenals, which are literally like a little roof on top of the actual kidneys. They fall under the kidneys too. So when you talk about about what you were saying, the hypothalamus, pituitary, adrenal axis, or this hormone stuff, they're not mutually exclusive. For me, it's still the kidney. And there was something else that I wanted to comment on. When you talked about hormones, for example, they often fall under the blood. So we go straight back again to Jing, essence, blood, hormones, kidney strength that holds the Jing, and the adrenals, which is again back to the kidney. So it's not mutually exclusive. You not say it has to be either this or that. They are just 2 different paradigms
that hold different functions in the body. Yes. That's actually such a helpful way of explaining it. So it's really more of a kidney system in Chinese medicine.
Kidney system, but the kidney system links with the liver system, with the heart system, with the lung system, with the spleen system. So that's that whole circle. Really annoying but very empowering cycle of the organs, where you can eventually philosophize your way anyway. So people always say, but which organ is it? And they still want to think about things quite black and white. And although there's a tendency to have more of kidney weakness aspects, for example.
Yes, I did. You told me every time I come here.
I remember. Okay, so it's very clearly kidney. But it doesn't mean that we completely could ignore the liver, or completely ignore the spleen, which helps with the dampness. So if you look at dampness and mold and so on, that's the spleen. So everything then again interrelates. You can look at a problem from every angle. So that can be so frustrating also from people in the very Western medical mindset. You're never wrong.
So many people are trying to conceive, trying to get pregnant. And as you see, birth rates are really reducing as well globally. And so what are some problems you've seen like women have to deal with in conceiving? And then how is TCM helping?
So I see, for example, people who come in with a confirmed diagnosis of PCOS, polycystic ovarian syndrome. Often, not always, often they belong to the more damp type, or we call it invisible phlegm type. It's a certain type of even body shape. And then as soon as you talk damp, which I alluded to before, we have to look at spleen. How would I treat that if it's something PCOS? And again, it doesn't have to be all the time. But I would look at the damp factor and how strong is the spleen in this instance. I do use a lot of additional lifestyle hacks. I do have to look at people's blood sugar regulation, how sensitive is their body's response to insulin, or has the body already started to have a little bit of an insulin resistance. So then I would ask the patient to be tested for something like a fasting insulin or an insulin response test, even better. And invariably, a lot of times actually, even with a very healthy blood glucose level or a healthy HbA1c, which means like for the last 3 months, and from a Western medicine point of view, they are not pre-diabetic, but when you test their fasting insulin, it's a little bit higher than what it should be. And so then I will also, besides looking from a Chinese medicine point of view, looking at the spleen and dampness and mold and so on, I will also give advice in diet to see how can we make your body become a little bit more sensitive to insulin. And there's been quite a lot of people, for example, with PCOS, where they know they need to do something more from a Western medicine point of view. That's what their OBGYN or reproductive medicine specialist told them, and they're just getting ready. And then I've got quite a few people that in their time of getting ready, often it's 2 or 3 months only, before they then go on for the next part of Western medicine, that they've just accidentally conceived.
Yeah, so you're looking at both you're doing acupuncture and herbs working on their spleen,
for example,
from the Chinese medicine perspective for someone with PCOS. As, for example, there might be other root causes, and then on the other side, it's also looking at the blood sugar and the dietary. Okay. Interesting.
But what I also see is endometriosis.
So
those are the cases. They come with an already, how do you call it, diagnosed ailment. But there's also people who come with undiagnosed, like unexplained fertility.
Yes.
Husband's semen analysis, nothing to look at, all fine, and yet it's not quite working. Then we really go and look at the garden. And see, hey, why are these bushes just not thriving?
Absolutely. And that's when you get into the root cause of all of that. Okay. Yeah, so I was an unexplained fertility case. No one could find out what was, from a Western perspective, what was wrong. From a TCM perspective, there was a lot of things wrong in the garden. The kidney, there was spleen issues with the dampness. Ultimately, I think what TCM did was get my garden to be a lot stronger. But then ultimately we found out afterwards that even I still wasn't getting pregnant. And so I went to do IVF. And after I did IVF, we discovered that I had a physical problem, actually an undiagnosed polyp blocking my tube, right? So there was just no way to really get pregnant, or very low chances for it to stay. But what I did find was that TCM strengthened my garden to the point where, on the first transfer, I was able to, after we got rid of the polyp, the physical problem, I was able to conceive, and now I have a healthy 10-month-old boy who is absolutely very, very beautiful. And I might be biased, but I love it. So how can TCM support someone like me who's still going through IVF and IUI, and I had to still go through the intervention procedures? Because I think a lot of women who are in that situation, it's either or. So how can TCM support them?
So it doesn't have to be either or. Absolutely, it can really work in tandem. Once a person goes into the IVF trajectory, I see my role very much just as the support.
Okay.
So then I always ask patients, when was your last scan? What showed up, for example, under stimulation? Are the follicles growing in cohort? Or is this very little response? How is the lining thickening if a person is getting ready for a transfer? Seeing how far we can improve that. And of course, circulation, blood flow is so important. So at least blood flow to the ovary to support whatever the reproductive medicine practitioner is doing. Blood flow to the uterus when we're getting ready for transfer as well. So it is really, and it doesn't have to be either or. And there's some doctors who actually don't even mind herbs. At the beginning, it was very clearly, when I started earlier, patients were asked not to have herbs. I see that the sentiments started to shift a bit, and that some doctors say, oh yeah, actually it's okay, you can have some herbs, just make sure that the practitioner you choose has done a lot of fertility work or something like that. So it's starting to shift, and acupuncture is for sure an absolute, no reason not to. In the fertility trajectory.
I actually came to you just, I think, within the 24-hour period before I went to transfer.
Yes. I'm quite specific about that. If a person comes too many days beforehand, it's not, I feel there is still a chance, and of course this is a stressful time, that the chi blocks up again and the blood blocks up again, because we really want to have optimal capacity of what that person is capable at for that time to be in the uterus. And I see the uterus as not being a passive wall that just, you guys need to do all the work. The uterus is like a living, dynamic entity. So I do believe that you can support that part. It's okay, I'm going to hold on to you. I'm going to and support you immediately. And
The implantation part.
Yeah, implantation part.
And actually, that's something from like when you go to an obgyn or fertility doctors, the implantation part is actually harder for them to support. It has to be a lot more there's like more physical invasive procedures, like they have to scratch the uterus and stuff like that. But with TCM, because I remember my lining was sometimes a little bit thin because I had blood circulation issues, but with TCM you were able to increase
the thickness of the lining,
and that gives you a better chance for implantation. I know so many women are struggling with a thinner lining. Especially as we get older and everything.
So Western medicine, they use estrogen, of course, they're using hormones to help with that. Even Viagra sometimes gets used. And they do help a bit, but I've also had patients where all of that was thrown at them and they still could not get, usually they aim for 8 millimeters or more on the endometrial thickness and have it in nice 3 layers. And some just can't get beyond 6. With everything, and then medicine is also, I don't know what else to do.
Because I remember when I transferred, I was at 10, and that was with the support that you.
That was a very good thick line.
But that was very rare for me. We worked at getting the garden ready, like you said, to take the baby and help to hold it. Yeah, absolutely. Okay, great. This has been absolutely fascinating. What I do want to hear more about from you is you're running the Vitality Clinic. You are, and every day you're showing up to work and you're helping so many people. What are some memorable cases you can share with us that really keep you going and keep you so motivated?
At the moment, besides fertility, I also, of course, see a lot of other issues, cancer and autoimmune disorders. And so that's definitely, okay, what else can I add today? But then there's, of course, some successes keep me going as well. And you ask about memorable situations. Sometimes the really easy ones stick because they were so easy. I mentioned about the case where a lady, relatively, not even that young, in her late 30s, but relatively healthy, good diet, good lifestyle, did exercise and so on. And she just, for no unexplained reason, again, could not conceive. And people were just saying, oh, it's your age, but actually her AMH was still quite good.
Right.
So your age on your passport is high, but that reason doesn't hold water to me. If your AMH and FSH and all those markers are still good, you should be able to conceive. When I first saw her hands, feet were cold, and then I remarked on that and said, yes, their office is always so, the air conditioning is always strong, but I've always had cold hands and feet. All I asked her is to wear socks, even in an office environment, and make sure that the aircon is not on her belly, and that if she herself starts feeling a little bit of cold, then she's way beyond that. So don't only not feel cold, feel snug.
Okay.
Feel snug.
Yes.
And don't worry about how you look. And it was not the first month, but I think the second, definitely not later than the third. Nothing else had changed, and that was so easy. She was pregnant.
So that was simple
I think I saw her
circulation.
Maybe 2 or 3 times. That was it.
Wow.
Yeah. So was every now and then. It's a simple thing. Chinese medicine has all these interesting ways of saying it. They say the uterus was cold, so she just suffered from a cold uterus. Simple like that.
And gave her ways to warm it up, and acupuncture helped a little.
Helped a little. I think the biggest help was her just keeping warm. I also see people with premature ovarian failure that are premature because they don't follow the stage of the gene that I mentioned. And then where they were told that that there's no chance and that they're already postmenopausal, as in periods has stopped. And then all the markers indeed confirm that. I had one patient, she did not get a period, and it was getting nice and she still didn't think so much about it. She was a bit stressed and it just didn't come anymore. And then she had to test it and they said, sorry, you're already beyond. And then she, in a knee-jerk response, she said, okay, IVF. And they gave her the strongest, whatever. The doctor didn't want to do IVF, but she herself insisted. And of course, no response, no follicle. So she threw a lot of money at it and they aborted the whole procedure. They had no choice. There was nothing growing. And so she came the month after. So every now and then you have cases like that. Or trauma-induced premature ovarian failure. Also seen a few of those where it's very clear, so not less and less, but just trauma. Patient didn't realize, may have even been on the pill, stopped the pill, period didn't come back. And it's really nice and very gratifying to help a person reverse that.
Okay.
And where the period starts coming back.
So you've had cases where the period actually came back?
Yeah, it came back, and where some people just want to have the periods back and not even try yet for pregnancy, and other people actually get pregnant. And,
wow.
Of course, I'm telling you that you asked for memorable, so I will tell you the real success stories.
That's incredible. So this person that came back to you, she got her period back, but then also was able to get pregnant later, or?
Wow. Yeah, I had a few. Yeah.
Oh wow.
So one where it was more gradual. She ended up having 2 children.
Oh wow. Okay.
And the one that's really trauma-induced postmenopausal ended up getting periods back and almost immediately fall pregnant and has one child. And another one that actually right now who I'm seeing now is just told me she had her first period. So let's just see.
That's so much hope, because I have a lot of friends who are going through IVF because of their AMH levels or because of perimenopausal symptoms, and they still want to have kids. And that's because we're all having children later as well. So I want to ask you one last question. You are treating so many women as a TCM practitioner. What is some advice you'd like to leave them with?
Trust your body.
Yeah.
Because the body innately has that longing. The gene wants to be passed on, right?
Yeah.
So
that congenital or whatever.
Yes, it's that instinct of procreation.
Yes.
So trust that. Have hope. Yeah. Hope is a warming energy, in my opinion. Expectation is a controlling energy.
Okay.
So hope, no expectation. Try to be healthy, and as part of health, that innate right of being fertile just comes as a bonus, kind of.
Yeah.
And please, for all these high flyers, these women who have made it in the corporate world and had to use a lot of that masculine energy to get there. Yeah. They have learned to use mind to create success.
Yeah.
Fertility is by definition a yin. Okay, mind is more a yang aspect, and we didn't talk about the yin and yang specific details, but fertility is very much a surrendering kind of energy. You have to step back, which these women have not learned to do. These women is more like you have to concentrate, discipline, be better, work harder, be smarter, all of that yang aspect. And now fertility is like, I'm trying all these tools that helped me before to be successful, and it's not working for my fertility because it's a completely opposite energy. You need to step back, you need to dare to surrender with that hope, but no expectation.
Yeah.
So I always say to women, get your brain out of your uterus.
Yeah, that's
please. There's some space. Hold the space.
And
then another one talking about brain is, I know of no woman who's ever conceived a baby and held the baby in the brain. So brain out and don't try to conceive here.
Yes, yeah. Beautiful advice. Honestly, Cecilia, you bring the faith into your practice when I say faith, the faith that this is going to happen, because your body is naturally wanting it to happen. And you remind us that, because I remember hearing that from you so many times, and that helped me a lot. And I actually I was working like a 12 to 15 hour day job required a lot of energy of mine. I remember I had to really change my perspective and almost let go of that kind of work and shift into work that would allow me to the time to surrender and have that yin aspect. Now, everyone doesn't have that privilege or that ability, but I think even emotionally, mentally, like having that advice is absolutely life-changing advice, and hearing it again. So thank you for coming and speaking with me.
Thank you for having me.
I learned a lot today, and I hope that everyone who's listening will also learn a lot. And I can't recommend Cecilia more. As you've heard me saying, Vitality Clinic has helped me a lot, and many of my friends, and Cecilia in particular. So
thank you so much. You're an inspiration yourself.
Oh my gosh.
And for everybody listening, you took ownership. And that's another thing that I would recommend. So on one hand, don't have masculine energy, but on the other hand, yes, do also understand that taking ownership doesn't mean it's a male thing. You're still part of this whole journey. And what can I do for myself? And
keep trying, basically.
And you did
don't lose hope.
all of that. You were amazing. Very inspirational.
It was a long journey.
Not an easy one.
Now we're on the recovery side of that journey. But look, I've heard so many more inspirational stories after talking about my fertility journey from women, that women are just amazing powerhouses of strength and
creativity and love. I love what women. The combination of, on one hand, being able to hold space, having that yin aspect, having the creativity, and having the strength.
And having to go through everything. Yes. Well, thank you so much.